बिस्मिल्लाहिर्रहमानिर्रहीम। रब्बी शरह ली सदरी व यस्सिर ली अमरी वहलुल उक़्दतम मिन लिसानी यफ़क़हू क़ौली। अल्लाहुम्मा इन्नी अस्अलुका इल्मन नाफ़िअन व रिज़्क़न तय्यिबन अमलन मुतक़ब्बला शिफ़ा मिन कुल्ली दा। Today the topic of discussion is the fetal skull. This is Dr. Zunaira Faiz. I want to just discuss shortly about the fetal skull and the related pelvic features. Female pelvis, because it is the fetus skull which has to pass through the birth canal and then is the body. 3 P's, that is the power of the uterus, the passage and the procedure, which is fetus. These 3 are very important for the labor. The fetal skull, it is large compared to the infant's total body length. Fontanelles, that is fibrous membranes connecting the cranial bones, allow the brain to grow, convert to bone within 24 months after birth. This is a picture showing the fetal skull, that is the lambdoid suture. Biparietal, it is 9.5 centimeter, and then is the coronal suture. This is the anterior fontanelle, it is the posterior fontanelle, and midline suture, it is the sagittal suture. Again, fetal skull, we can appreciate here, it is the kite-shaped membranous structure, that is the anterior fontanelle, and posterior fontanelle, that is the triangular area. Here is the frontal bone, parietal bone, and this is the occiput bone. The fetal skull, here we can see the frontal bone, sphenoid bone, anterior fontanelle, parietal bones, then posterior fontanelle, occipital bone, and this is the mastoid fontanelle and temporal bones. This is a very important picture which is showing the different diameters of the fetal skull, and not all the diameters, they are favorable to pass through the pelvic inlet and outlet. And here you can appreciate there are some very long diameters which cannot at all pass through the birth canal. Here we can just see, here it is the sinciput. Here we can see the root of the nose, and this area is the sinciput, and this is the brachma. Brachma, it is the anterior fontanelle, and this part is the vertex. Here lies the lambdoid suture. This is the occiput. And now if we measure the diameter one by one, that is from the mentum, that is the chin of the skull, chin of the fetus, to the brachma, that is submentobrachmatic 9.5 centimeter, and this diameter it is presented in the face presentation. And here that is the verticulomental 13.5. This is presented in the broad presentation, and here this diameter is 13.5 centimeter, cannot pass through the pelvic outlet, and here where the cesarean section is indicated. And now this side, if we see suboccipital brachmatic diameter, that is from this point, from the occiput to the brachma, and this is the most favorable diameter, it is 9.5 centimeter, which is also called as the vertex presentation, and this is a favorable diameter for the normal delivery of the fetus. Occipitofrontal, again it is from the frontal to the occiput point, and it is 11.5 centimeter, and this is vertex presentation of the deflexed head. Again, it is not the favorable diameter. Favorable diameters are only 2 diameter, that is the submentobrachmatic 9.5 centimeter and suboccipital brachmatic, that is 9.5 centimeter. These 2 diameters, in this is the face presentation, and in suboccipital brachmatic vertex presentation is there. In this picture we can see the side view of the fetal skull. Submentobrachmatic, that is the face presentation, 9.5 centimeter, mento vertigo-mental broad, that is broad presentation male, 13.5 centimeter, occipitofrontal, that is the vertex, and military. It is not favorable diameter to pass. Suboccipital pragmatic, then where is the flexed head, and this is most favorable diameter where the fetus can easily pass through. Actually, the diameter, if we see the passage of the birth canal, the dilatation, diameter is 10 centimeter. So 9.5 centimeter can easily pass through it. If we see the pelvis, female pelvis, there are 3 bones which are, this is the hip bone. 3 bones, they are making it: ilium, pubic bone, and ischial bone. And in between these 2 hip bones is the sacrum. Sacrum, it is the base, and apex is down where it is connected to the coccyx. Acetabulum. Acetabulum, it is the articular place for the hip joint. Ball and socket variety of joint, synovial joint. In this picture, in this diagram, you can see again it is the sacrum, base of the sacrum, and it is the apex, coccyx. This is all the sacrum. Here lies the hip bone. Again the second hip bone, iliac fossa. This is pubic bone, ischial bone, and pubic arch. This is very important, and this whole is the bone. The pelvic bone, when we see, if it is adequate, capacious, then the fetal skull can easily pass. If it cannot, then cephalopelvic disproportion, and which is the indication for the cesarean section. In female pelvis and male pelvis, if we see the differences, here like many differences between the two. In particular, the pubic arch in the male is usually less than 90 degree, whereas the female it is really greater than 90 degree. If we see this pubic again, this is the greater than 90 degree, and here it is less than 90 degree. It is the male pelvis. Here the fetal skull has to pass through. Here again, if you see this side, sacrum, and it is coccyx, iliac crust, greater sciatic notch, it is broad, and here greater sciatic notch, it is narrow. And if we see the outlet, that is the inferior view, ischial tuberosity, this is pelvic outlet, and it is anteroposteriorly broad, and it is transverse, and here it is narrow in the male pelvis. Again, if we see the diameters, it is 12 centimeter in the mid cavity, all over equal, all 12 by 12 centimeter, and here lies the inlet. If you see the inlet, it is transversely broad, 13 centimeter, and when you see the outlet, it is the antero-posteriorly broad. This is pubic bone, this is ischial spine. These are the 2 ischial spines, and inter-ischial spine distance, it should be more than 9.5 centimeter. So the fetal skull can easily pass through. If it is less than 9.5 centimeter, the fetal skull cannot pass through it. If we see the anatomy of the pelvis, the structures: uterus, urinary bladder, labia minora, this is ovary, rectum, cervix, vagina, and anus. We will see the views on all of them. What happens here? The baby grows, and at the term, about 40 weeks, this birth canal, it will form the birth canal. It should be dilated enough to let the fetus to pass through it with the submentopragmatic diameter, or the submentopragmatic diameter, or in the case of face presentation also, again where it is 9.5 centimeter, it is the dilatation. Mentopragmatic. diameter. Here you see the iliac crust, sacral promontory, again ilium, sacrum, ischial spines, coccyx, pubic bone, pubic symphysis, pelvic rim, anterior superior iliac spines. And here it is making the space. This is hole is important place which is letting the baby to pass through. It is C-shaped and the baby move downward, forward and upward towards the vulva. Again in the diameter we are showing in the different picture different forms. Inferior view we can see pelvic outlet. It is anteroposteriorly broad and this is the ischial spines. Here we always see the station of the fetal head. If the level of the ischial spine at that level we say it is the -2 station. Pelvis diameters, if we see what happens inlet, anteroposterior 11, transversely it is 13 cm, oblique is 12 cm. Pelvic cavity, all the diameters are equal, so it is round almost. Pelvic outlet, it is anteroposterior 13 cm and transverse is 11 cm. There are 4 different types of the pelvises. It is the gynocoid, it is capacious and it is favorable pelvis for the normal delivery of the fetus. Platyplate, it is just like when the plate is in the dimension of the plate is transversely long and it is like that. Android, it is the male type and it is the anthropoid, it's just like this. You can see the oblong. Again if we see the pelvic 12 cm, it is the call of the cavity diameter and 30 cm at the inlet it is transverse and 30 cm anteroposteriorly at pelvic outlet. These are the dimensions of the pelvis. So if we compare with the fetal skull and the maternal pelvis, its diameter should be favorable with each other to rule out any possibility of the cephalopelvic disproportion. With that, thank you very much. I hope it will help you for study. Jazakallah khair.